I know that it can be an overwhelming time when somebody finds out that they're pregnant, and expectant parents are typically given a number of different tests during pregnancy that they're offered to determine whether the baby could have certain genetic conditions. And many of these tests are screening tests, like you mentioned, and some are diagnostic tests. And screening tests are designed to say whether there's a high or a low risk or a chance of a condition in a baby. It can never give a definitive answer, and follow-up diagnostic testing is always recommended after somebody gets a high-risk result on a screening test. And so again, that compares to a diagnostic test, and then a diagnostic test can give you that definitive answer. I like to use an analogy in this situation, one that I'll borrow from a fellow genetic counselor, Ellen Matloff. You can think of screening tests kind of like the screening that we get when we go to an airport. So when we walk through a detector at an airport before we get on a plane, you may walk through a detector, you may have your carry-on bag screened through the machine. And the idea is that they're going to pick up whether you could be carrying something, right, that you shouldn't bring on an airplane. And that's the screening part. And if that detector beeps, you kind of move to the next level of testing, and you may be patted down by an agent, you may have your bag searched, and then that would be the diagnostic part of that testing process. And many times during that pat down or during that search of your bags, they may find that, hey, you forgot to take off your belt, or you left an unopened soda can in your bag. And so that doesn't mean that the screening failed or was wrong. It means that it identified somebody who needed additional testing to find out if there was really something going on. So that's an analogy that I think kind of helps understand the difference between screening and diagnostic, even in the pregnancy setting. And so some of the screening tests that are available during pregnancy are blood tests that are drawn on a pregnant person to see if the baby has a high or low risk of certain chromosomal conditions. And non-invasive prenatal testing, or NIPT, sometimes known as NIPS, is a form of chromosomal screening test that parents get offered during testing. And NIPT typically screens for trisomy 21, which is an extra copy of chromosome 21, also known as Down syndrome. It also usually includes screening for trisomy 18, which is an extra copy of chromosome 18, or trisomy 13, which is an extra copy of chromosome 13. And NIPT sometimes can include screening for certain chromosomal conditions called microdeletions as well, where a small piece of a chromosome may be missing. 22q11.2 deletion syndrome is an example of a microdeletion condition that can be screened for on a screening test as well. And so these are just some of the tests that, again, that Natera offers and that pregnant patients get offered during pregnancy.